Hey, it's Rich. Welcome back. This is my 67th week since I started taking Wegovy. As you recall from last week, or you may know from last week, the insurance company cut me off. They said no more Wegovy for Rich for a variety of reasons. A couple of weeks ago, they sent me a letter in the mail. The insurance company said that they hadn't received enough information from my doctor to assume that we should continue using the drug. So I talked to my doctor. My doctor said, "Well, you need to come in and see me." Now, my doctor, my long term doctor, had just retired, and this is a new doctor. So I thought, well, maybe that's all it is, and that's actually what my doctor thought was. Well, maybe something went haywire in the computer system. They didn't recognize his name. They were looking for my other doctor's name, and they're saying, "I don't know what's going on," so we're just going to reject it. So he submitted it again. We talked about what my choices were. What my choices were: staying on Wegovy, going to a different drug, looking at bariatric surgery. I said I didn't want surgery, and I wanted to stay with Wegovy for a little while and see how it goes with my redoubled efforts for diet and exercise along with taking the drug. So he said, good. So he submitted it. My insurance company, my pharmacist sent another note saying, nope, sorry, hasn't been renewed. And I actually went in to the pharmacy and had them try it right in front of me. They said, well, let's just see what happens if I do it today. And they said, nope, still it's not approved. I got another second letter saying, hey, your doctor has not provided the right information for us to give you this drug, so we're denying it. So I sent another note back to my doctor, text message saying, still don't have it. I got a third. So a week went by, and earlier this week, I got a third letter from my insurance company saying, we now have all the information we need. You have not seen adequate results from the drug, so we're going to deny it. So after extensive review, they decided to deny it. And I thought, how is that possible? I lost, at least 80 pounds so far on this drug. Seems like something I should continue. So I thought, well, I'm meeting with my clinician on Friday, which was yesterday. I'll talk to her about it and say, what can we do? Maybe she can make a personal appeal, something like that. Ultimately, I got a telephone call from my insurance company, one of those automated ones, and I had to call back and listen to a message that they gave me. And they said, hey, we now have all your information and we've decided to renew it so you can go to your pharmacy and pick up the drug. So I'm back on Wegovy. Yay. Shouldn't have been this hard. And I shouldn't have had 2 weeks of not having it. And in fact, when I talked to my clinician yesterday, she kind of started talking to me about how long have you not been taking the drug, and are we outside the window of you just jumping right back into the 2.4 highest level dose, or should we titrate you up somehow? I said, well, I've already got the drug. I've already got the 4-week supply that I picked up on Thursday, I think, the day before. And she says, well, just so you know, you might have some of the negative consequences that you were experiencing recently with constipation or loose stools, which I don't understand how those two things go together, but they do, and all the other things, upset stomach, indigestion, things like that, all the things that go with increasing the dosage. So you may experience some of that again, but it'll subside, and hopefully, and just like it has, and you'll be fine. So we decided to just go forward. Shouldn't have been this hard. It just shouldn't have been. And I don't understand why it happened. I'm assuming there's something in the insurance company's process to just start denying the drug and see if people fight back. If they argue back, then they actually think they're getting a benefit. So, maybe that's all it is. Maybe it's that extra effort that they want you to do to continue using the drug. And this is an easy way to eliminate people who really don't want to take it anyhow. They're not seeing the results, or they're not actually even taking it. Maybe they're just taking the supply drugs and not even bothering anymore. I don't know. You can see on the screen right now, I'm showing you my exercise for the past week. I exercised every day in the past week. Some days I went a little faster, some days I went a little slower, but I went the same distance, which is what I'm targeting right now. And I've been very conscious about my diet. And for the most part, don't talk to me about last night. Last night was horrendous last night. I had all kinds of snacks and goodies and yeah, that was a bad night last night. Really bad. Well, all right. Anyhow, let's talk about something a little more fun. Why did the chicken cross the playground? If you got a little kid in your life, you can tell this joke to them. Why did the chicken cross the playground? Why did the chicken cross the playground? To get to the other slide. I know it's terrible. It's awful. But if you have a little kid, they're going to giggle. So that's good. I think I told you that I'm very much an addict around food. I'm an addict around all kinds of things. I have phobias. I have all that. I just recently gave up chocolate, marshmallow, and nuts. I have to be honest. When I gave up chocolate, marshmallow, and nuts, I have to be honest. It was a rocky road. Oh, sorry. I think it's funny. And now I'm thinking about Rocky Road ice cream. So, oh boy, that was not a good joke to tell. All right, how did I do this week? Like I said, I was doing okay this week. I was not on the drug. By the way, I just took the drug a few seconds ago, so I'm back on the drug. I don't know if I said that in the beginning. I think I gave you the story without that I'm taking the drug. So I took this new dose just a few moments ago. I'll see how it all goes. How did I do this week? Last night was horrible, awful, 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 awful. Um, and I ended up gaining 1 pound this week. I'm a total of 87 pounds down, but I'm back on the drug. I'm redoubling my efforts. We'll see you next week.